Have you ever watched someone you love struggle with anxiety or depression and felt helpless? Or maybe you've sat in a doctor's office trying to explain that something doesn't feel right inside, only to leave with a prescription but no real answers. You're not alone. I'm Kamilah McGuire, and like many of you, I've seen this firsthand. The truth is, mental health challenges impact every family, every workplace, every community. And when someone finally reaches out for help, they often face a healthcare system that isn't prepared to respond.
Hi, I'm Robert McCarron, founder of the UC Irvine's Train New Trainers Primary Care Fellowships. What Kamilah is describing is something I've witnessed throughout my career and experienced in my own family. As a physician, I can tell you that primary care providers want to help with mental health concerns, but they simply haven't received the training to do so. This became clear to me growing up, watching my own mom struggle with depression and sadness. As a child, I didn't understand what was happening. Years later, as a medical student and internal medicine and psychiatry resident, I finally recognized what she had been experiencing and helped her to get the treatment she needed. That experience showed me that with the right training, we can transform lives.
That's why the TNT Fellowships are so revolutionary. Instead of accepting the status quo, we created a solution that meets people where they are, in their own communities, with providers they already know and trust.
We take doctors, nurse practitioners, and physician assistants who already have medical training and equip them with additional specialized mental health expertise. Our one-year fellowship offers 3 tracks: general psychiatry, addiction medicine, and pediatric psychiatry, enabling providers to address the vast majority of mental health needs right in their primary care practice.
What makes this approach so powerful is that we're not just training individual providers, we're transforming entire communities. Let me introduce you to Nicolette, a nurse practitioner who grew up in Pico Rivera, California, and now serves the under-resourced community she calls home.
I am so thankful for this program because I feel like I just learned. It was just like a wash of information. And it was so many patient scenarios that I'm like, this is what I deal with every day. Everybody in primary care needs to learn this because it's so hard to see a psychiatrist and it's so hard to get with a therapist. And this kind of gives you the tools to be that mediation.
Over our 10-year history, we've seen this story repeated hundreds of times across the country. Our fellows stay in their communities, providing care where it's needed most, and teaching others what they've learned, creating a ripple effect that continues to grow.
Imagine a world where your loved one or you can walk into a doctor's office, share your struggles, and receive compassionate, effective, and evidence-informed care right away. Not in 6 months, not after being referred to 3 different specialists, right then and there, from a provider who understands both your medical and mental health needs.
This vision is within reach, but we need your help. We need your partnership. Many of our fellows come from under-resourced areas and rely on scholarships to get this training. Your support makes it possible for dedicated clinicians to gain these critical skills and bring them back to their communities.
By supporting the TNT Fellowships, you're not just funding a program, you're helping create a world where getting help for mental health is as normal and accessible as treatment for any other healthcare condition. Join us in transforming mental health care. Make your gift to the TNT Fellowships today and help us train more frontline providers who will improve mental health care access for countless lives.